Hello and welcome to this live stream. So today we are going to discuss a very high yield topic for licensing exams. I have highlighted some important points for you to notice. So according to the question, we have a healthy 34-year-old man who presents with a 2-week history of right upper quadrant pain, nausea, fever and jaundice. He has no family history of serious illness. He has 4-year history of IV drug abuse and he shares his needles. His immunization record is not known, and 6 months ago he was offered screening for hepatitis B, during which he was negative for hepatitis B surface antigen and antibodies against hepatitis B C. And he refused hepatitis B vaccination at that time. So on examination, he is ill. He has a fever, his pulse is high, and his respirations are 10 per minute. His blood pressure is 109, that is usually a low limit of normal. On physical examination, he has scleral icterus. His liver is palpated 3 cm below the right costal margin. The lab studies shows increased prothrombin time, indirect hyperbilirubinemia, and raised AST and ALTs. So further workup includes serological studies and quantitative PCR that indicates infection with hepatitis B virus. So just looking at this question, we have understand that patient is suffering from acute hepatitis and he has developed a complication of liver failure due to hepatitis B infection. So we have to diagnose what are his serological findings. So in acute hepatitis, the hepatitis B surface antigen should be positive as it is a marker of acute infection. And during acute infections, the patient has not developed antibodies to hepatitis B surface antigen yet. And during the period of acute infection, the virus is replicating rapidly. So hepatitis B E antigen is a marker of viral replication. So it is positive in acute infections. And we can understand that antibodies should not be formed for hepatitis B E antigen right now, as it is an acute infection. So now we have to look at two very important antibodies. These are antibodies to Hbc Igm and IgG. Igm is a marker of acute infection and IgG is a marker of resolved infection or a chronic infection. So this patient should have positive hepatitis B surface antigen, hepatitis B E antigen, and positive Igm antibodies. Everything else should be negative. So the most likely answer should be B. Yes, the B is the correct answer. So now let's get into our minds and understand the basic concept of acute hepatitis and chronic hepatitis and all of the serologies. So basically in acute hepatitis, the patient usually has hepatitis B surface antigen positive, and we have discussed every single possibility, right? But sometimes patient present in a phase that hepatitis B surface antigen is negative. Now we have to think that hepatitis B surface antigen should be positive for acute infections, and the patient has symptoms of acute hepatitis, but his hepatitis B surface antigen is negative. What is this phase? This phase is called window period. So usually what happens is when hepatitis B surface antigen is positive in acute infections, during the period, the antigen is converted into antibody. So patient presents between this period. This is called seroconversion or window period. So how are we going to define this patient has an acute infection? So we're going to look at the Igm antibodies. Anti-Hbc Igm is positive in window period. Everything else is negative and patient has acute hepatitis. So basically, this patient could progress to resolved infection or chronic infection. So if this patient progresses to resolved infection, so what happens is HbS stays negative, anti-HbS antibodies are now gonna form in this patient and he become positive for anti-HbS. Hepatitis B antigen gets negative at this point and anti-HBe becomes positive, and his Igm antibody is negative and IgG could be positive as it is an indicator of past infection. So he has a resolved infection. So now let's discuss what if this patient progresses to chronic infection. So again, hepatitis B surface antigen remains positive for 6 months, and after 6 months it gets negative, and anti-HbS antibodies, or if positive, the patient has resolved the infection. But if these are not found yet, the patient is in chronic infection. So the patient has negative hepatitis B surface antigen, negative anti-HbS, positive hepatitis B antigen. That is, the patient has some replication and anti-HBe is not formed yet and anti-IgG is positive. So patient is in chronic infection. Again, this patient could progress to resolved infection, or the chronic infection can progress to fibrosis and cirrhosis. So basically, now let me give you a short and concept of viral serology. So the most important point is hepatitis B surface antigen. It is positive in active infection. Hepatitis B antigen is positive in active infection, and IgM is positive in active infections, right? And in chronic infections, antigen to hepatitis B surface is negative and anti-HbS is negative. That patient has not resolved his infection. Anti-HBe is negative and anti-IgG could be positive. So basically we have understand what is acute infection, what is chronic infection, and what is the window period of hepatitis infection. So a little trick to remember all of this is surface antigen and E antigen equals has. So patient has acute infection. Core antigen is has/had. So IgM, he has acute infection. IgG, he has past infection. Surface antibody equals had or vaccine. So he had acute infection in the past, or he had vaccinated for hepatitis B.